Understand Medicare in 15 minutes. First things first, you need to sign up for Medicare Parts A and B so you can get your red, white, and blue card as shown on this slide. You do this by signing up for Medicare at your local Social Security office, or you can do it online. When you sign up for Medicare, there's usually no cost for Part A, but for Part B, most people will pay $144.60 per month. This will come out of your Social Security check if you are taking it. If you're not taking Social Security, they will bill you. With just original Medicare, you would have Part A, which covers hospital costs, and Part B, which covers outpatient costs, such as office visits, lab work, outpatient surgery, things like that. If you just use original Medicare, you will pay a $1,400 deductible if you are hospitalized. For outpatient expenses, you would pay the first $198 and then 20% thereafter. It's important to understand that there's no cap on the 20%. As an example, if you have a $30,000 outpatient surgery, you would pay $6,000 of it. This can add up to some big numbers in 1 year. Also keep in mind, with original Medicare, there is no prescription coverage included. After you signed up for Medicare Parts A and B, you basically have two options to help you cover your portion of the medical expenses. Option 1, you can stay on original Medicare and buy a Medicare supplemental insurance policy. Along with that, you would also purchase a Part D drug card to help cover any prescription costs. Option 2, you would enroll into a Medicare Advantage plan. Let's take a closer look at Option 1. Under Option 1, you would purchase a Medicare supplement insurance policy to pay for the Part A deductible. If you remember, this is the $1,408 deductible if you're hospitalized. It also pays for the Part B, which is the outpatient care, the 20% coinsurance. Today, the most popular Medicare supplement sold is Plan G. The average cost of a Medicare supplement is $130 per month at age 65. This rate will increase year to year as you get older. Remember, original Medicare nor your supplement cover prescription drugs. So under my Option 1, you would also purchase a Part D Medicare prescription drug plan. These plans are offered through private companies and are partially funded by Medicare. The average cost of a Part D prescription drug plan is about $35 per month. This rate will also change from year to year. It is important to know that if you do not enroll into a Part D drug program when you're eligible, you may be penalized for not having it. This can be a lifetime penalty. To summarize Option 1, you will have 3 monthly premiums to pay. $144.60 for your Part B Medicare, $130 for a Medicare supplement, and $35 for a Part D prescription drug card. Your total monthly cost would be about $310 per month. Under Option 1, you would not have the additional benefits such as dental, vision, and hearing aids. Let's look at Option 2. Under Option 2, you would enroll into a Medicare Advantage plan. A Medicare Advantage plan basically rolls Part A, Part B, and Part D together into one plan. Medicare Advantage plans are offered through private healthcare companies but are funded by Medicare. Most Medicare Advantage plans have little or no cost monthly. Most plans cover your medical, prescriptions, dental, vision, hearing aids, gym memberships, and they even give you an allowance to buy health-related items over the counter. Even if you enroll into a Medicare Advantage plan, you are still required to pay the Medicare Part B premium of $144.60. Let's take a look at a sample Medicare Advantage plan and what your costs would be while covered under one. Unlike option one, where you pay monthly premium and have very little out of pocket for medical care, when you are covered under a Medicare Advantage plan, you pay what's called co-payments for services that you use. If you look at this slide, we will look at a sample plan and what you would pay. Under this plan, you would see the premium is $0 per month, so you do not have to pay anything for the plan. When you go to your primary care, you would pay $0 under this program. If you go to a specialist, you would pay $35. Urgent care visit, you would pay $30. Wellness care is covered in full. They have a long list of wellness care that is covered under the Medicare Advantage plans for free. Lab tests would be $10. Emergency room would be $90. Basically, if you go to an emergency room, whatever they do to you, you would get a bill for $90. If you have x-rays, you would pay $14. If you have an outpatient surgery, you would pay $0 to $295. So it's important to have examples with this. So if you go in for an outpatient surgery at the hospital, and it's a pretty expensive, let's say it's a $30,000 surgery, you would get a bill for $295 for the whole thing. That would cover the anesthesia, the room, the surgeon, everything else. If you go in the hospital overnight, you would pay $295 a day for the first 4 days. So it's important to use examples with this. If you're in the hospital for 10 days and you have 2 surgeries or whatever, your total bill at the end of that stay would be $295 times 4, which is under $1,200 for the whole visit there. Another example would be, say you go in for a knee replacement and you're in the hospital for 2 nights and you come out. You would pay $295 times 2, which is under $600 for your knee replacement surgery. So not bad. Also, what these plans do is they give you a copay maximum per year. In this case, it's $3,900. What this does, this protects you in case you have a crazy year where you're in and out of the hospital and you're adding up a lot of bills. You can't pay more than $3,900 in copays. So it's not a deductible, it's a copay maximum. That's important. Also, the national numbers on this is 3% of the people on these plans will even hit their maximums in 1 year. It's pretty hard to do that with the copays that you're looking at. Under a Medicare Advantage plan, your Part D prescription coverage is built into your plan. So there's no need to purchase a Part D prescription drug card. It's already in there. Typical prescription drug coverage will have 5 tiers of drugs. So typically you will see Tier 1 and Tier 2 are generics, low-end generics. In this particular sample plan we're looking at, you'd pay nothing for Tier 1 drugs, $5 for Tier 2 drugs. Some plans do offer a mail order where Tiers 1 and 2 will be shipped to you at no cost at all. Brand names and expensive generics will fall under Tier 3, which is a $45 copay per month. And then there's drugs that are more expensive, would be non-preferred drugs at Tier 4. And then at Tier 5 drug would be like injectables, specialty drugs where you would pay 30% on. Medicare Advantage plans include additional benefits that option 1 does not provide. Extra benefits would be vision exams, which would be free on these plans. Most plans provide an allowance for glasses, so you can buy frames and lenses for your glasses, or you can get contacts instead of glasses. Dental is included in most plans. Some plans just cover preventative dental. Some plans, like the one we're looking at, the sample plan, they provide preventative and comprehensive up to the first $1,000 for the year. Gym membership would be free on almost all plans. Hearing aid coverage, some plans will cover all your hearing aids, some plans will cover partial of them, some will just give you a discount on them. Transportation to and from doctor's appointments, for people that need that, there are plans out there that include this benefit. Then we have the over-the-counter allowance, which basically is there for you to purchase health-related items such as vitamins, over-the-counter medications, toothpaste, a whole bunch of stuff. And in this particular sample plan, they're giving you $80 per quarter to go ahead and purchase that. So every quarter you would get $80 to spend on that stuff. If you don't use it, you don't use it, but they would be there. A lot of the plans, or most plans, work with Walmart. Some are working with CVS. It's important to know when you purchase a Medicare Advantage plan, these plans have a preferred list of doctors and hospitals that are covered under their plan. So you need to be sure that all your doctors that you want, your specialist, your primary care, the hospital system that you want to make sure that's covered under the program you're looking at. Different Medicare Advantage plans cover also your drugs differently. So one plan may cover the drug you take at a tier 3. Another company may cover the drug at a tier 2. So it is important, and it may be the decision maker of what plan you go with based on your prescriptions as well. So that needs to be looked at when you're considering these plans. Plans also that include dental benefits, they usually have a list of covered doctors or dentists that you need to use. So you want to make sure your dentist is covered, or you'd be willing, or if you're willing to switch your dentist, that's fine too. Additional benefits will also be different from plan to plan. So some plans will have dental, routine dental. Some will have routine and comprehensive dental covered. Some will have transportation. Some won't have transportation. Some provide a better vision benefit than another, or a hearing aid benefit that's better than another. So when you're looking at these plans, you want to be sure that the additional benefits that you're interested in are covered under the plan you choose. All these variables make shopping these plans a bit tricky, and it does take a good amount of time to research. Medicare Plan Match was started just for this reason, as far as the complexity of looking up all these variables on the plans. Is your dentist covered? Is your doctor covered? How are your medications going to be covered? That's what we do. So basically what we do, we have a process called the Medicare Plan Match process, where you would go in, you would fill out a form, which would include name of your doctors, name of your dentist, name of your medications, any additional benefits you're interested in. We get that information, then what we do is we shop and compare all plans based on what you gave us. We then match you with plans that would best meet your healthcare needs. We answer all your questions, and then we would enroll you in a plan of your choice. That's pretty much as simple as it gets. Pretty much you relax, we do all the work and take care of it for you. So to wrap things up, basically you have two options. Option one, you would have 3 ID cards. You would have a Medicare card, your Medicare supplement card, and you would purchase a Part D prescription card. So you'd have 3 cards that you would use. You'll have coverage for your medical and your prescriptions. Your estimated monthly cost would be about $310, plus you would have to pay the Part B deductible, which is $198, and of course any co-pays that on your drugs you would have to pay. Under option 2, you have 1 card, provides coverage for your medical, your prescriptions, your dental, vision, gym membership, hearing aids, and an over-the-counter allowance, plus more benefits that we talked about. Your estimated monthly cost would be your Part B premium, which is $144.60, and then any co-pays for services that you use medically or even prescriptions. And that's it, though. That's your options, option 1 or option 2.